Hello, my name is Maeve Kenningham, and back in 1991 I came over from Northern Ireland to study at Liverpool University, where I qualified as a doctor in 1996. I then went on to do general practice training and achieved my membership of the Royal College of General Practice. I then, whilst I was doing my training in general practice, I had an attachment in dermatology, and I realised then I also had a passion for dermatology and the skin. I then went on to achieve further qualifications and experience as a dermatology specialty doctor in our local hospitals. So not only was I doing general practice, but I also had an interest in dermatology, and I also train other GPs and I act on behalf of the Royal College of General Practice for that. I first established my clinic back in 2012, and the reason behind that was because I had reached my 40s. I was working arduous hours in general practice. I have two young lovely girls, and my husband was also working full-time in the NHS. So age was taking its toll on my face. I looked tired, fatigued, which I was. So then I started looking into, well, what other things can I do to improve my appearance other than the creams, which didn't seem to work, didn't seem to freshen my appearance. And when I started researching about Botox and fillers, I thought, actually, well, can these procedures not be performed in a way that make people look natural, look refreshed? Because it seemed to me that the procedures seem to make people look artificial and inflated and unnatural looking, and that was something I certainly didn't want for myself. So that was what kind of spurred me on to researching more about aesthetics, and in a way, because I had that specialist interest in dermatology and in general practice at this stage, I had 20 years of experience of general practice. I thought it was a lovely way of incorporating all my strengths and skills into something which has now become quite a passion of mine. My ethos in my aesthetic practice is actually to restore what has been lost over time, to understand the fundamentals of what ageing has created in the face, such as lost bone structure, lost fat, lost elasticity of the skin, and with the tools that I have, replace what has been lost, but in a natural looking way, and of course in a safe way.